Welcome to Politics Done Right. I am your host, Egberto Willies. This is a progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, progressive, conservative, or otherwise, you get to air your point of view. We are an independent media outlet that, unlike mainstream media beholden to corporations, we only owe allegiance to you. Remember, you can also send me a tweet at EGBERTOWILLIES. That is at Egberto Willies. Let us engage. It is Politics Done Right. Welcome to Politics Done Right from the studios of KPFT 90.1 FM, Houston, your community radio station. We have a great program for you today. Did you know that we had, of all developed countries, one of the worst COVID outcomes? We're going to talk about that. Chris Hayes took a closer look at Biden's economy. I think you're going to like what you have to hear instead of listening to all the fallacies about what's really going on. Hospital executives, you know what they want to do? Hospital executives want to ask the Biden administration to cut the salaries of nurses. Put a restriction. These nurses are putting themselves at risk. But what do we want to do? We want to cut their wages. But did any of these guys who work for these hospitals cut their wages for the executives who some make 15 million, some make 70 million? What have they done to earn that? Did they put their bodies at risk for that? I think not. Again, that is our economic system. We're going to talk about that. Jeff Reese, the former president of Houston Peace and Justice Center, he is going through some issues with cancer and his insurance companies. I want you guys to listen to that story in detail, but I don't want you to only listen to that story. I want all of us continuously to do something about it, because all these issues that are happening that I've discussed over the last few weeks just prove Medicare for all is the only, absolutely only option. But before I want to thank some great supporters of Politics Done Right and KPFT. John Schwager from Houston, Texas, thank you so kindly. Bruce Pollard from Porter, Texas, thank you so kindly. Bruce Allen from Houston, Texas, thank you so kindly. Andrea Gardner from Huntsville, Texas, we really could not do it without you. Dan Limbaugh from Magnolia, Texas, you are a hero, my friend. Thank you so kindly for supporting this show, for supporting KPFT and all that you do. Mike Franklin, Spring, Texas, thank you so kindly for being a part of this system. And Jeff Reese, who's going to be featured today, have always been a contributor to KPFT. And you know what? We have always made sure that all of KPFT, everybody, all our listenership, everybody has free and equal access to these airwaves to make sure that your story gets told, to make sure that it's always done right by you, because this all belongs to you. We are in our winter fund drive, but folks, please stick with me. I'm not just going to give you a fund drive pitch. I'm not just going to be doing a whole lot of pitching. I'm going to do a short pitch here at the beginning. I'm going to do a slight little pitch in the middle, and then at the end, a small pitch. Don't forget, please support the show. Support the station as well. Why am I asking you to support KPFT 90.1 FM Houston? It is extremely important. Remember that KPFT embraces cultural diversity. We represent the entire Houston, the entire metropolitan area. We represent the entire country. KPFT supports programming that's not the status quo. We challenge the status quo. We don't give you what the corporatocracy just want to give you. We are here to tell you not only the truth, but to express it in a way that we all understand. That's KPFT's job. We are not trying to forget the past. We embrace the past, and we are there to celebrate the future because things change. What am I saying? Please remember KPFT 90.1 FM is a gem. We are in the process of moving. We are in the process of relocating to a new space. We need you more than we have ever needed you before to keep this thing going. Over 50 years of giving you great info, not only progressive programming, but alternative programming. What do we mean by alternative programming? We mean things that you are not going to get elsewhere. We also mean telling you the truth about things that others may not want you to know. So please remember, folks, call 713-526-5738. Again, that number is 713-526-5738. But even better, visit kpft.org. Click the donate button. Make sure you select Politics Done Right for the program. The form will give you your donate and gift options. Please get one of my several books out there. As I see it, Class Warfare, the only resort to right-wing doom, for a contribution of $120. It's worth it. How to talk to your right-wing relatives, friends, and neighbors for a contribution of $120. How to make America utopia, take away the economy from those who rigged it, for a pledge of $120. Get any two of those books for $200, any three of those books for $250. The contributions for my books go directly to support our station, KPFT 90.1 FM. Alternatively, folks, please get your basic KPFT only membership for $40, a Pacifica only membership for $25, or choose from one of our many other gifts for your contribution. Just go to kpft.org, choose Politics Done Right for the program, and select an option either for our books or something else to support the station. It is definitely worth it. Let's get busy.
Let's talk about American exceptionalism, ¿ok? Vamos a hablar del excepcionalismo de América. Vamos a hablar de eso ahora. Let's talk about it. I am an American citizen who want to make this country not exceptional, but exceptionally good to people. Exceptionally good to us all. But we're not. Check this out, and then we'll take that on the other side. Well, let me frame it first of all, because I'm going to turn this into a little cut afterwards. What we have is Chris Hayes did a piece on how badly the United States does compared to all the other industrialized nations, other wealthy nations. We have been doing a whole lot better, but because we've been infested by those who are reveling in their ignorance, in their willful ignorance. It's not that they're genetically or somehow ignorant, because nobody really is, but because of that, this is what they have allowed to occur. And yes, we blame them for it.
We are just days away from what would have once been considered an unfathomable toll of 900,000 Americans killed by the coronavirus pandemic. Take a look at this chart, which shows deaths among large, wealthy countries since the start of the pandemic, and some small ones as well. The U.S. is now at the top of the chart, overtaking Belgium and the U.K. with the highest COVID death toll relative to our population. Why is our death toll so high? Why is it so much worse here? Well, for one, just look at the vaccination rate of the same 10 countries who top the COVID death chart. You can see the U.S. is considerably behind in the percentage of the population who's fully vaccinated and considerably behind on booster shots. That's not likely to change. According to the latest Morning Consult survey, nearly 20% of those polled are just... We are just days away from what would have once been considered an unfathomable toll of 900,000 Americans killed by the coronavirus pandemic. Take a look at this chart, which shows deaths among large, wealthy countries since the start of the pandemic, and some small ones as well. The U.S. is now at the top of the chart, overtaking Belgium and the U.K. with the highest... We are just days away from what would have once been considered an unfathomable toll of 900,000 Americans killed by the coronavirus pandemic. Take a look at this chart, which shows deaths among large, wealthy countries since the start of the pandemic, and some small ones as well. The U.S. is now at the top of the chart, overtaking Belgium and the U.K. with the highest COVID death toll relative to our population. Why is our death toll so high? Why is it so much worse here? Well, for one, just look at the vaccination rate of the same 10 countries who top the COVID death chart. You can see the US is considerably behind in the percentage of the population who's fully vaccinated and considerably behind on booster shots. That's not likely to change. According to the latest Morning Consult survey, nearly 20% of those polled are just unwilling to get the vaccine. And vaccination rates aside, our population is already just much less healthy, more at risk than people in comparable rich countries. Researchers of the Commonwealth Fund found that countries like Australia, Germany, and Canada, clustered in the center of this chart, have much better healthcare systems than the US, down in the bottom right there. And that's even though the US spends way more on healthcare. Our life expectancy is lower than other rich countries. It has been that way for decades before COVID. The pandemic is exposing the dark parts of American exceptionalism, and we now have the highest death rate in one of the richest countries in the world. What does this say about us? About what kind of country, what kind of we are?
And that is something that we have to take into account, right? One, the reason this is true is one, we have a lousy healthcare system because it's mostly to make money for a few. Numero dos, we have a population that is very unhealthy, again, because we allow our corporations poison our own citizens because money again comes ahead of everything else. And numero tres, we are happy to preach ignorance. We are happy to preach ignorance and much more.
Hospitals are now screaming. Hospitals want the government to get involved in the private sector. You know, we wanted healthcare in the private sector, right? Now the private hospitals want the government, the Bush administration, to come into the private sector and tell their opponents that they cannot price their nurses at these high rates to travel around the country and do nursing. They want to cripple it. So the Hospital Association and all these other people, they don't want to pay nurses. To which I ask, what about us going into the executives of these corporations who makes not hundreds of thousands of dollars, but millions of dollars? Suppose we go in there and say, look, you guys are squandering the monies that people are paying to the hospitals. Okay? How can a CEO be worth $15 million and he complains about a nurse who's going to make a couple of $100,000 because she's working or he's working their butts off for 18 hours a day? See, that's how capitalism works. We, the executives, we, the shareholders, the ones that do nothing of consequence to the actual business, we don't want our mega salaries cut, but those darn nurses, if they're making a little bit too much, that's going to eat into some of the profits that I can make. We need the government assistance. We need the government to come in to this capitalist society. We need the government to come in and get rid of those nurses' ability to price themselves higher. Wow. Isn't supply and demand supposed to work? If we wanted to have nurses at better pricing, what we would have done is the corporations would have paid taxes so that nursing schools and medicine, like schools of medicine, could actually have bigger classes, could have more nurses, and all of that. They just needed to pay taxes so we could afford to educate more nurses, more doctors, etc. That's all they needed to do. Pay your taxes so that the government that you're begging now to put chains onto nurses, that instead of using the government to put chains on people, use the government to expand the field. Pay your taxes. You don't want to pay taxes. You want to give an inordinate amount of money to your shareholders and executives and the people who actually do the work, the nurses. You want to neuter them. Wow. When I talk to you guys about capitalism and the evils within, These are the kinds of concepts that I talk about. Nobody talked about get the government in there to tell them to stop paying CEOs the kind of salaries. These are public companies, right? Private companies, but publicly, meaning a lot of people invest in these companies. Suppose somebody say, okay, government tell them they cannot make that kind of money. They simply cannot make, those executives are not allowed to make that kind of money. That's what we need to do, right? So I want you guys to really think about this. Anyhow, we were talking about the economy earlier. The economy, as you're going to hear from Chris and his guests, it's pretty good. But as some of our people in the chat here says, which they are absolutely right, it doesn't cut the same across the board. So when my good friend Paul Fleming says, 4% is one thing, but let's look at everybody. There is a problem. He's absolutely right. I want you to listen to this, and then we'll go ahead and take it on the other side. Check it out.
Great piece out in the Atlantic today that really captures my feelings about this economy and how we've been trying to cover it here on this program. The headline, somewhat cheeky, "The economy is good, actually," and it is by the fantastic economics journalist Zachary Carter, who also wrote the award-winning book The Price of Peace, which is a biography of economist John Maynard Keynes, a book I really highly recommend. Of course, it's Keynes's theories that help guide the world out of the Great Depression. Keynes's thinking has also guided the economic policy we have seen during the current recovery, huge amounts of fiscal stimulus and federal spending. In fact, as Carter notes, the federal government spent far more money over the course of the pandemic than it did in the response to the 2008 crash, and spent more of the money on ordinary families. And the results of all this are tangible, like the child tax credit expansion cutting child poverty in half. For workers, the 467,000 jobs created in January are more than triple what was expected. That's allowing people to leave their jobs for better ones at record levels, raising low-wage worker pay even after factoring inflation into the mix. Even bankruptcies dropped by 24% in 2021. Look at that. That's us all the way over on the right. That's the lowest point for personal bankruptcy in decades. That's a 25-year chart, and it's never been lower on the chart. The only real question I have, and it's a persistent one, is why won't the left take credit for such an incredible accomplishment? Zach Carter, who wrote that piece, joins me now. Zach, first make the case. I make this case a lot. I think you and I are in a sort of small cohort. We're sort of in a lonely group trying to make this case. I think partly because you and I both went through the ideological battles of the Great Recession, the failures of austerity, the huge amounts of prolonged human misery that was completely unnecessary because of the sort of austerity argument winning. But give me the short elevator pitch version of why the economy is good, actually.
Well, the last crisis, it took us 10 years to get to this point on employment after the crash. And unemployment is currently 4%. It's been about 2 years since the beginning of the pandemic. The crash this time around was much more severe. Millions of businesses just shut down. The unemployment rate went much higher, well over 14% compared to 10% last time around. It was a deeper crash, and the action in the real economy in a lot of ways is even worse. The pandemic is still going on. We're still living with the Omicron wave right now. So there are a lot of reasons why this crash should have been really, really terrible. Look, there's been a lot of hardship. A year ago today, 15% of American parents were saying they didn't have enough money to feed their kids. So, it's 5 times the typical rate in the United States. That's not happening right now because we spent a lot of money, and we spent a lot of money on American families. That doesn't mean the economy is without its problems. It's just of the sort of menu of options that you had a year ago, 2 years ago. This is far beyond anything that I thought was even remotely on the table.
Okay, think about that, folks. Think about that. The economy is doing a lot better than we all know. Bankruptcies are at the lowest rate that anyone have seen in decades. People have more money in their checking account, better than they've seen in the same time last year, this time. There are numbers over and over again, but yet there's the angst of the people. Well, you know why you have the angst? There's some inflation that is created by the plutocracy. I want you all to put blame where it belongs. I wish instead of bringing Biden's numbers down to 41%, you would bring down the money, the CEOs of ADM and all these companies who are raising the prices. Let me give a qualification. If these people's stock prices are going up, if the amount of money that they're bringing in is going up, if they're shipping the same amount of products or more, what that tells you is that they're ripping the people off and they're doing wealth transfer. They're redistributing the money of the masses to the pockets of the few. And what they also continue to get those people by lying to them to believe some fallacy that somehow they're helping. Don't forget, please support the show. Support the station as well. Why am I asking you to support KPFT 90.1 FM Houston? It is extremely important. Remember that KPFT embraces cultural diversity. We represent the entire Houston, the entire metropolitan area. We represent the entire country. KPFT supports programming that's not the status quo. We challenge the status quo. We don't give you what the corporatocracy just want to give you. We are here to tell you not only the truth, but to express it in a way that we all understand. That's KPFT's job. We are not trying to forget the past. We embrace the past, and we are there to celebrate the future because things change. What am I saying? Please remember KPFT 90.1 FM is a gem. We are in the process of moving. We are in the process of relocating to a new space. We need you more than we have ever needed you before to keep this thing going. Over 50 years of giving you great info, not only progressive programming, but alternative programming. What do we mean by alternative programming? We mean things that you are not going to get elsewhere. We also mean telling you the truth about things that others may not want you to know. So please remember, folks, call 713-526-5738. Again, that number is 713-526-5738. But even better, visit kpft.org, click the donate button. Make sure you select Politics Done Right for the program. The form will give you your donate and gift options. Please get one of my several books out there. As I see it, Class Warfare, the only resort to right-wing doom, for a contribution of $120. It's worth it. How to talk to your right-wing relatives, friends, and neighbors for a contribution of $120. How to make America utopia, take away the economy from those who rigged it, for a pledge of $120. Get any two of those books for $200, any three of those books for $250. The contributions from my books go directly to support our station, KPFT 90.1 FM. Alternatively, folks, please get your basic KPFT only membership for $40, a Pacifica only membership for $25, or choose from one of our many other gifts for your contribution. Just go to kpft.org. Choose Politics Done Right for the program and select an option either for our books or something else to support the station. It is definitely worth it. All of you who listen to Politics Done Right knows something very important about what we do. We believe in values. We believe in humanity. We believe in doing the things that are right to society. And we've always known that in this society, the healthcare system has been worse than what we could call organized crime. It's an evil entity that uses people's illnesses to make a profit. And today I want to introduce you to Jeff Reese. Jeff Reese is the former president of the Houston Peace and Justice Center. Jeff Reese is a former police officer. Jeff Reese is a former sergeant. I'm talking about one of the good ones. Welcome to Politics Done Right. Jeff, how are you doing today?
Good, sir. Good. My brother, how are you doing?
I am doing great. Well, Jeff, I've been keeping in touch with you over the last few weeks because of something that has come over you. So it's given that you're giving me the opportunity to do this interview, why don't you tell me a little bit about what's going on with your health?
Well, Egberto, I think many of us pay into an insurance policy thinking that we're covered, that our premiums are going to take care of us in our old age. I have retired from Harris County after 26 years, and I always thought we had fairly good insurance, like many people, until problems arise. And major problems come up. I've been diagnosed with a thing called multiple myeloma, which is a form of treatable but incurable cancer. And it's predicated on how soon you were able to discover you have this cancer as to the longevity that you have. And my story started a long time ago, but let's just say in October 23rd, I went for a CT scan because I knew there was something wrong, possibly had tumors, and the CT scan was denied by my insurance. And I keep in mind that my gastroenterologist, that he wrote the orders. I just had the wonderful experience of having what do you call that when they go in the back door? Anyway, yeah, you know. Anyway, we just had that done, and they didn't find anything.
Colonoscopy.
That's it, colonoscopy. I had so much fun. I blocked it out of my mind. Anyway, nothing was found, so to speak, including my brain. So I was still having problems, and I asked him to, if he could, give me a referral for a CT scan to see on my if there's anything going on. So he did, and I did everything I was supposed to. I showed up that morning, and the company said, "Oh, we can't give you a CT scan because your insurance denied it." And I had no idea this was going to happen, And this was the beginning of a very, very unpleasant experience and awakening about our insurance industry.
Well, before we go any further, Jeff, I want to name names. Going forward in all these things, we name names. Which insurance company are we talking about?
Cigna.
Okay.
Cigna Insurance. And while we're naming names, this is a little background. Cigna bought a company called Express Scripts. You see, it's a big money-making thing, everything surrounding the insurance industry. So they bought a company called Express Scripts. Well, Express Scripts, in turn, bought another company that deals with medical billing called Evicor. And Evicor claims to, be the gatekeeper, if you will, of good medical procedures, and they tell you the world, but then they promise you, everything else and give you something. But, and I'll read this real quick just so you understand what I'm saying, or I'll tell you right now. Evicor provides a service to any insurance company that will hire them to filter through the claims. So Cigna hires their own company, which is called Evicor, though they deny it's their company and say it's a third-party independent, which is a lie, because they use Express Scripts. And the deceit only gets deeper from there. And so I'll read you this. The Blue Cross and Blue Shield actually uses Evicor also because they're very, very good at what they do. And this is coming from a law firm that said about Blue Cross and Blue Shield that their use of Evicor as a gatekeeper of patient care appears to be intentionally designed to delay care for patients and enable Blue Cross and Blue Shield to deny payment for as many covered services as possible. And in the end, they say this: they claim that they are the insurer vehemently denies that, and they said that the company is more friend than foe to patients, ensuring that their care meets the latest evidence-based guidelines. Okay, what they said was that claim strikes many critics as outlandish and even in bad faith. It is unquestionable that legions of healthcare principals believe that doctors who actually see and diagnose patient conditions are better arbiters of what comprises proper treatment than are for-profit employees working in a distant company. Right?
Absolutely. It makes no. Yeah. What you're telling me is that Cigna uses a level of abstraction in order to deny you coverage, and they can find cover by saying we use a third party so that it seems like we are not somehow involved in denying you service for profit.
Exactly. When it's quite the opposite. And I'll tell you my story, and then I'll read you some examples that are out there on the internet.
Exactly.
And so in my case, I was denied for the CT scan. Well, lo and behold, long story short, I get blood work done and I find out that I have what's called multiple myeloma. And so the doctor, which is standard procedure, according to Cigna's own internal documents, which I was able to uncover, that is the proper way to determine, as far as myeloma, it's plasma cell cancer. And the tumors are in your bones. And the only way for them to determine this is to do an MRI through the bone MRI. And I did have a bone biopsy, which also determined I was positive for this wonderful disease. And so, lo and behold, Cigna denied this procedure, or Evercore, let's say. It doesn't matter. It's the same company. Cigna gets paid to manage Harris County's insurance, the self-paid system. They get managed paid. Then they hire themselves, their own company, then gets paid double to deny the claim. And then they even make more money. To give an example, last year, the CEO of Cigna, made $79 million in a one-year salary. $79 million. But it gets better. Cigna made $75 billion in revenues. And they denied the smallest things to make that profit. It's all about profit, not about people, And it's a really a terrible, horrible thing. It is so bad, Egberto. There's a thing called the Association of the American Society for Radiation and Oncology. This is a professional group of doctors, of surgeons, professionals. They were so upset about Evercore, and using this excuse. The CEO sent a letter to Evercore, and they were concerned about what was going on. But of course, the same song and dance. Oh yes, we're not going to do that. And they're, again, hopeful things will change, but they didn't. And so again, in my case, the same procedure that would help diagnose where the tumors are in my body are being denied. So then I got a second denial. The first denial was from a young woman, a doctor who was a radiologist, mind you, in New York. I know you're closer to New York than I am. I've never been to New York. Mm-hmm. But this woman who gets paid to deny claims denied my claim. So I appealed it. I got a second denial from another doctor. This time he was an osteopathic surgeon in the Air Force, and it came from Lackland Air Force Base. No, I'm not in the Air Force. I've never seen this man, but somehow, according to their terminology, this MRI was medically unnecessary for multiple myeloma. So I've been fighting and trying to get something done. And so finally, my oncologist was able to schedule a round of chemotherapy starting on Monday, finally, because I'm in so much pain. I don't know if you know anything about this disease. Pain medicine doesn't work on it. And so I'm in terrible pain. And finally, they give me this chemotherapy, not knowing where the tumors are in my body.
That's what I was about to ask. You're right. Getting chemotherapy. There may be tumors in your bones. Quick question. Do they ever excise those tumors if they know where it's at, or do they ever do that?
Well, they can, but what the chemo does shrinks and kills the cells.
Right.
So that's where they start. And it affects your liver and it affects your internal organs. But again, MRI, even a CT scan would see something for the soft tissue. So they finally said, okay, we're going to deny your MRI again, but we're going to allow you to have a CT scan, which is of no help to my bones, but my soft tissue, where I'm sure I've got stuff going on, because you know your body,
Right.
I've been around with mine for 62 years. Trust me, I know all about it. And
right.
And so they said, we're going to approve that. But guess what? After they say they approve it, and my doctor applies, hey, we need the CT scan, they lied. They never approved it. And so now, instead of denying it, they just don't approve it. And so it sits there in a 2-week window.
In other words, it delays. It delays, and you can't have the procedure anyway.
Right. So I had no intention of giving this test to me, right? So I'm forced to take chemo, which, she says at least it'll help with the pain in my body, so I'm all for it. And then there's 2 or 3 other drugs I'm having to take along with it. I'm going to do an infusion. So there's some medication I need to take. Well, today I got a notice that it's not, you're either waiting for this drug to be approved. And it's like, what? They go, yeah, Evercore and Cigna have not approved the drugs that go with my chemo. So what's going to happen if I show up without this to my chemo? They're going to have to cancel the chemo. These guys are slick. They know what they're doing. I'm sorry. I just, at this point, it's very, very devious to what they do.
Well, I mean, the truth of the matter is, one of the congressmen that I interviewed, I can't remember his name right now. He went on the floor of Congress once and said that the what they call was a GOP medical plan was if you don't get sick, but if you get sick, die quickly. There is a thing. There's a man. It's my buddy, and I can't remember his name right now. A congressman. He's running again in Florida. But anyhow, it is amazing. The reason I really wanted you to come on again was to make the case that I've been trying to make for a long time. And that is, these people have no care for humanity, and all of those people who are there defending a system where if what occurs to you is granted, what's going on in your body may not happen to 95% of the Americans, so they'll not see. But some other disease is going to afflict other Americans, and those other diseases, they will run through the same kind of crap that you're going through right now, where the insurance companies give them a runaround before they can actually get any type of procedure. And in the process of going through and waiting for all of that, some people just give up and say to hell with it. Or some people just go ahead, and by the time they have approved it, it's too late anyway. Your thoughts?
Well, one of the responses was from a woman said, for a $2,000 MRI, I had to put my husband in hospice. You refused and refused to have this done. By the time now, I've put him in hospice and he's died. And they never approved the MRI. This is how they save money, unfortunately. It's so obscene that you would think, oh, no way. I'm not going to. It's kind of, there's correlation to some things that happen in other industries, but this one alone, there's what they take a Hippocratic oath to help people. And yet they find people who sell their soul for money and are willing to sign off on the dotted line. And they have what's called a peer-to-peer review when all else fails. And they say, okay, well, you're going to have a peer-to-peer review. And if you look at the doctors that denied in many cases, one woman had a dentist in the peer-to-peer review. One person had a chiropractor. Now, I haven't seen that because by now they're getting a little slicker. They know that they're getting scrutinized, so they're smarter now. But this actually happened to this woman in the peer-to-peer review. It's a terrible thing, actually. There are other, and the problem is also, Alberto, in Texas, Greg Abbott, he benefited. He won millions of dollars against medical malpractice. And when he went to the state Congress and all that, he did what they pulled the ladder up behind him, because they voted and supported legislation for their buddies in the insurance industries and the medical industry. They called it tort reform.
Right.
We live in 1984.
Tort reform.
Yeah. Right. And it's 1984. It's double speak. Just like Evercore claims to be, out for the patients and to do all these good, wonderful things, they're actually doing the opposite. So what tort reform did is prevent anyone, such as myself, from having a shot at suing these people for malpractice, because the most I can get is $250,000 in that neighborhood, and the attorneys can't. They limited the damage the attorneys can get. So it's very, very hard to find medical malpractice attorneys, and so the insurance, when you threaten them with a lawsuit, they laugh. You just made $75 billion. You think $250,000 is going to worry these people?
What is amazing is that Greg Abbott took advantage of suing when that tree fell on him and he didn't get the right kind of cure. And he wasn't talking about tort reform then. And he got quite a few $1 million, as I recall, for that wheelchair that he's in right now. And it's amazing how you forget that other people can be hurt as well. Now, folks, I want to express something here, because I wanted to use Jeff as to show a real life example of what our healthcare system looks like. All of you out there who believe that a private healthcare system somehow give you choices. I mean, that is an argument that's used a whole lot. The reason I don't want the government controlling the healthcare system, I don't want the government controlling healthcare insurance, because I want choices. You never, ever have choices in the private sector. The choices are always made for you. Jeff is just one of millions of examples every single year where this happens. It has happened with my daughter. It has happened with my wife. It has happened with Jeff. It has happened with Jeff's relatives. It has happened with your relatives. So the fact of the matter is, one of the reasons we want to do this is trying to let people see life and death situations where, in effect, we have a corporatocracy that is killing you. We have a healthcare system that by design, and don't blame the individual workers in the healthcare system. You cannot blame them. It is a system predicated on profits. It's a system where Milton Friedman has said, the sole purpose of the executive is to maximize profits for the shareholders and bonuses for the executives. How else can they do that? Their monies is what was denied to Jeff. Jeff, continue, please.
Oh, well, gosh, I guess I've been doing a lot of research and I've come across so many examples. I don't mind dying, but I sure hate to think that if I kept quiet, someone else is going to die. And so basically we've got to stand up. This right here says, my husband has worked for the same company for 31 years now. Approximately $1,700 per month is paid in healthcare premiums in order for us to have good healthcare. Of that, we pay 25% plus deductibles out-of-pocket expenses. It is a travesty that we should now be forced to fight for the quality of care and service that we pay for and deserve without having to worry and stress over delays in treatment during the most difficult of circumstances. So those people who claim that we have this wonderful healthcare system, they apparently have never had to use it. Not in a serious way.
And that is what's amazing, because I've been working for myself for decades now. And I've always, knock on wood, I've never not have insurance. And until my wife started working for a particular district, we paid insurance out of pocket, the very high prices that a sole proprietor pays for insurance. I mean, altogether, I've paid hundreds of thousands of dollars in insurance and medical bills over the years. And the thing about it is, when you really need it, that is when you realize that you don't have it, or you have, they count. There were times I was charged $5,000 out of pocket, and until I raised hell and told them I was going to, that first of all, that I was the media and that I was going to expand on it, that is the only time I ever got these bills cut. My thing is interesting. The fraud that occurs in the healthcare industry. And you cannot call it anything other than fraud, and it's occurring on human beings. Give me some more. I think you had some others that you found.
Oh, yeah, I've got tons. But going back to my case again, in the contract that Cigna signed with Harris County, they have what's a little disclaimer. As long as this procedure is medically necessary, they agree to pay for it, right? That's why they hired Evercore to step in and say, oh, it's not medically necessary. I guarantee if these idiots get cancer, you'll find out what's medically necessary and what's not. But even anybody can know with Google what is and what isn't medically necessary. And so this woman here, it's like, she said Dr. 1 had listed out a psych, dentist, a physician assistant, a radiologist. Dr. 2 had listed out a family medicine doctor. You're going to love this one, listed a speech pathologist and an OBGYN. Now, these are peer reviews for brain cancer. And these are the doctors that Evercore is saying is making that decision that this procedure is not medically necessary, And it's really funny. But she asked, how do any of these medical professionals consider themselves in the same category as 3 highly skilled, very reputable cancer specialists that are treating my husband's cancer? Very easy. They're the ones that the Evercore and Cigna listen to. And it's
because they'll deny it. Now, it is. I want to get one thing straight here. The people that denied your services, do you get the name of doctors who have denied your services?
Yes, and this is very important. I'm glad you bring this up. So if you, God forbid, are in my position, this woman that I just quoted, she found out through the Federal Registry. It's called NPPES. Okay, I think it's .org. You can go there, and any doctor's name you can plug in and find out his qualifications.
Right.
And that's how I think they got smart, because she did this. And that's how she found out the psych, the dentist, and the radiologist, what they were actually. They make a lot of claims, okay? And she said, now that I know it's Evercore that is the issue, and knowing my husband needs yet another scan to make sure this cancer is spreading, I'm well prepared for a battle with these greedy pinheads. So this poor woman found that out. So if you need to find out a doctor's specialty and qualifications that the NPPES, you go there and it will tell you. you know?
Now,
And,
what are you said you got the actual names of doctors who denied your MRI, correct?
Correct.
And
That's
did you look?
one was in Staten Island, New York. Now, keep in mind, they've never seen me, never read my record. Okay. All they did is sign a piece of paper that said the procedure was not medically necessary in their expert opinion.
Now, the next question that I have for you is that you have these two doctors that denied your services. These doctors that denied your services, are they cancer specialists?
No, neither one. One's a radiologist and one's an orthopedic surgeon, which he should know better, but he is right now in the Air Force, and he's their head of their branch.
So they are really just what they do is they hire doctors all over the country that are simply consultants. So they get a stipend for saying yay or nay.
Sure.
Right. Well,
yeah, they get it. Yes.
What I'd like from you, Jeff, as well, is I'm going to take this because there's a blog that goes along with our interview. I want to get the name of the insurance company that did this. I'd like to get the name of the doctors that denied with their qualifications that denied your service, because what we need to start doing is exposing this all over the internet so that the next time that other doctor denies a service, they will have a contact person that they can say, this person denied the service. And guess who? It was to Jeff Reese who had XYZ. And we will create a network of people that these people have maimed.
I'm glad you said that. I'm still in the middle of research. Every day I get up and spend hours trying to research on how to fight this company, both companies.
Right.
You know, I called the commissioners. You name it. I would. In fact, I think we're going to have to break down and do a press conference,
right,
and maybe explain to the media what's really going on, and find these 4 other people that are in the same situation I'm in.
Well, what I'd like you to do, because I'm going to put this up and I'm going to play this over on Pacifica Network, not only on our KPFT 90.1, but on Pacifica Network proper. So, meaning the other stations as well. So what I'd like for you to do for me is to give a call out to those people who are in similar situations and let them know that they should contact us. Let's go ahead and start making a network of people at this particular company. Not only the company, but I want the name of the doctors that are screwing people.
Oh, perfect. Yeah. And as far as my case, I can tell you right here, these doctors, and well, that's a CT scan. Let me see. Here's for the MRI. The doctor's name was Lynn. I have to spell it, Voutssinas. Now, I haven't finished looking her up. She's neuroradiology, supposedly. That's what they claim anyway. And if so, she denied the first request. The second request was the guy that I told you about that's in Lackland Air Force Base. And
I tell you what, when we are done with this interview, I'll just ask you to send me some information as far as the company, the doctors. And what we'll do is we'll make sure that those doctors are indexed along with your interview so that somebody who finds them in Google will actually pick up your interview, and then you may actually get somebody to contact you. And folks eventually will work together to arrest these guys' horrendous type of work.
Well, maybe you can help me here. Egberto, I need a second opinion, and usually another opinion is always better than mine. But in my mind, this is a violation of the RICO statutes that was passed on a federal level. When they conspire to steal money from someone under false pretenses, that's a crime.
It is a crime. But, you have to have a clever lawyer that can actually show that it's a crime. I think a lot of these for-profits are really theft. A lot of these organizations that make profits on instruments of this type. In other words, these guys don't provide a service. Remember, this is tertiary. You talk about the Harris County hires Cigna, who hires, what's the name of the company? Evercore. Cigna hires Evercore in order to abstract themselves from some sort of to hide that they're, and then Evercore hires transcripts.
Well, no, Evercore takes care of everything.
Okay,
Cigna hires Evercore, which they own indirectly through Express Scripts.
Okay,
it's just one of their other companies. So it's called quality control.
Right.
They claim to manage these requests for service, and they help the patient, which is a lie. They help them by denying their claim. And so they do the opposite of what they say they do, but they make money from their parent company, who's getting, I think, 30%. I don't know what he gets from Harris County, but Cigna, there needs to be another insurance company if you're going to use an insurance company. The county has what's called a self-insured plan.
Right.
So I filed a complaint with the federal government. I filed a complaint with the state government. The federal guy called me back, really nice guy, and he told me I get these complaints all the time, but because it's a county government, it falls under the state,
Right.
Their control. And what he said is, when people file with the state, the state lies and says it's not us. You need to file with the federal government.
Right.
And so, just like they do internally, they keep passing you back and forth.
Well, it's a racket. It's a racket to protect. It's a racket to protect those who pay these politicians for the bad deeds that they do to their own people. So anyhow, I want to close out here. This is important. I am going to get all that information from you to attach to the blog as well, so that we can ensure that we start creating a network of people going through these particular issues, and eventually we'll reach critical mass. So Jeff, give me a quick closer.
Oh, God, put me on the spot, why don't you?
All the time, every time.
Every time, brother, every time. Basically, it's not giving up. I might have to die, but I'm not going to die quietly. I'm going to make as much noise as possible. And the only way to change something, I think, my guy I really admire much, he said this. He says, not everything that is faced can be changed, but before something can be changed, it has to be faced. And we have to get people to understand the system we have for insurance is horrible. It's against their best self-interest. The insurance industry and the medical profession don't do anything but stand between you and your doctor. In other words, if my doctor says, I'll do this for $50, here comes Cigna and says, oh, no. The doctor, you're going to take $40, and to me, you're going to pay $70. Why? Why do we tolerate this? Right? Now, I understand they do a function as far as managing the self-insured insurance fund, but what that means is not to make money. Why would someone make money off my premiums that I pay every month for the very services that they're denying me? And then what gives them the right to take it?
Absolutely no right. Jeff Reese, it's been my pleasure to have you as usual on Politics Done Right. I think your story, your statement is a service to the entire country, because stories like yours is what's going to make the change. Until we have a critical mass of your stories and people see inside of Jeff Reese what could actually happen to them, there's no change. But with your fight and with what we intend to do, there will be change. So keep strong, and you ain't dying anytime soon, brother. We're going to keep you alive because we need a fight. We need a fighter in this game. Thank you so kindly, Mr. Reese, for having been on Politics Done Right.
Thank you for what you do too, Egberto.
Thank you, sir. Don't forget, please support the show. Support the station as well. Why am I asking you to support KPFT 90.1 FM Houston? It is extremely important. Remember that KPFT embraces cultural diversity. We represent the entire Houston, the entire metropolitan area. We represent the entire country. KPFT supports programming that's not the status quo. We challenge the status quo. We don't give you what the corporatocracy just want to give you. We are here to tell you not only the truth, but to express it in a way that we all understand. That's KPFT's job. We are not trying to forget the past. We embrace the past, and we are there to celebrate the future because things change. What am I saying? Please remember KPFT 90.1 FM is a gem. We are in the process of moving. We are in the process of relocating to a new space. We need you more than we have ever needed you before to keep this thing going. Over 50 years of giving you great info, not only progressive programming, but alternative programming. What do we mean by alternative programming? We mean things that you are not going to get elsewhere. We also mean telling you the truth about things that others may not want you to know. So please remember, folks, call 713 713-526-5738. Again, that number is 713-526-5738. But even better, visit kpft.org. Click the donate button. Make sure you select Politics Done Right for the program. The form will give you your donate and gift options. Please remember to keep your community radio station in your minds. Keep KPFT on your mind. Talk about it. Tell your friends about it. Tell them you know about this station in town, 90.1 FM Houston, that needs your support. That is there to provide that nourishment that we need. KPFT 90.1 FM Houston. You can listen and or watch Politics Done Right Mondays through Fridays on Facebook Live at facebook.com/Politics Done Right or on YouTube Live at politicsdoneright.com/YouTube. Please do not forget to follow me on Twitter for updates. My Twitter handle is at Egberto Willies, at EGBERTOWILLIES. But don't you forget, listen to us live on air at KPFT 90.1 FM on Thursdays at noon and at Fridays at 11 a.m. all Central Time. Please get one of my several books out there. As I see it, Class Warfare, the only resort to right-wing doom, for a contribution of $120. It's worth it. How to talk to your right-wing relatives, friends, and neighbors for a contribution of $120. How to make America utopia, take away the economy from those who rigged it, for a pledge of $120. Get any two of those books for $200, any three of those books for $250. The contributions from my books go directly to support our station, KPFT 90.1 FM. Alternatively, folks, please get your basic KPFT only membership for $40, a Pacifica only membership for $25, or choose from one of our many other gifts for your contribution. Just go to kpft.org, choose Politics Done Right for the program, and select an option either for our books or something else to support the station. It is definitely worth it. Well, folks, that's it for today. You know how I'm going to end this baby. My name is Egberto Willies. This is Politics Done Right. And you know how I end this baby. I am what? Out.
Welcome to Politics Done Right. I am your host, Egberto Willies. This is a progressive program that will take the mystery out of politics. This is the program that will encourage you to make sure government becomes we the people. Whether you are liberal, progressive, conservative, or otherwise, you get to air your point of view. We are an independent media outlet that, unlike mainstream media beholden to corporations, we only owe allegiance to you. Remember, you can also send me a tweet at